Hi, my name is Charity Fleming. I'm Anishinaabekwe from 𝗥𝗘𝗦𝗢𝗙 First Nation, and I'm also a mental health specialist and professional. And for Truth and Reconciliation, I'd like to share with you the truth about how genocide, legacies of genocide, and historical trauma impact people and generations today. So it's often, misunderstood, and, growing up in Northern Ontario, I know for myself, even I wondered, I had some internalized racism sometimes and wondered, why are there more of my people who are homeless or have addiction issues or these other health problems, and, why does my family have so many problems? And as I came to know more and complete a master's degree and do a lot more research on the topic, I learned some really important truths. There was a fantastic study. It's called the Adverse Childhood Experiences study. It was done in California and with one of the largest cohorts of people possible, 17,000 people. What the study showed, they identified 10 adverse childhood experiences, things from not having your emotions validated to having someone in the home who struggles with mental health problems or being abused or sexually abused, or other adverse experiences. And what they found is people with 4 or more, especially adverse childhood experiences, were far, far, far more likely. It was very direct correlations, and some would say causations, to experience very specific mental health and health challenges. Mental health challenges like predispositions to anxiety and depression, and a dose for dose, so each number more of adverse childhood experiences out of 10 would lead to an increase of 11% more likely chance of suicidal ideas or thoughts or attempts. But also, very interesting are the health implications. So, depending on how many adverse childhood experiences, a person is more likely to smoke or is more likely to have cancer or diabetes or other heart disease and other health impacts. So this became a groundbreaking study in the 90s and continues to inform us today. When people wonder, how come there's these problems of genocide? And sure, okay, maybe that impacted that generation, those kids who had those adverse childhood experiences. But what we know as well, we've been able to track from the 90s as well, or in the 2000s, is the impact of intergenerational trauma. So someone who experiences trauma, it's not just them that experiences the trauma. Even more research shows that females are impacted more by trauma. It's our biology, our brains are wired and constructed more for social meaning and impacts to our social relationships. So interpersonal trauma or person-to-person trauma impacts us especially more. Our brains are actually developed differently. We have thinner parts of the brains that allow for more impact of those things. But females especially carry those genes and pass it on to their children. So there is a clear genetic link between intergenerational trauma transmission. And that trauma transmission, that child doesn't need to experience any trauma at all, but is automatically predisposed to many of those same things as the adverse childhood experiences correlations lead to. So increased risk for anxiety, depression, post-traumatic stress disorder, psychosis, suicidal ideation, and increased health risks as well, like cancer, diabetes, smoking issues, or smoking, and addiction issues and other things. So these intergenerational trauma transmission, they first identified this after the Holocaust, and they were able to track that these children, these generations, actually followed 3 generations. So when I think about my grandmother, 𝗥𝗘𝗦𝗢𝗦𝗢𝗥𝗘𝗦𝗢, who went to residential school, simply through genetic transmission of trauma, I have been at far more risk at some of these health and mental health impacts. So when you wonder why are there these prevalences of these issues, it is because of the history of genocide And when the last residential school just closed in the 1990s, we are only looking at some of the first or second generations of this intergenerational trauma transmission. That is my truth as a mental health specialist, and I ask you to consider that truth, to challenge your own stereotypes or interpretations or internalized racism, even of who are Indigenous people and why do they struggle so much. That is my truth. I ask that you help me so that we can resolve and reconcile these truths so they no longer plague my people. Miigwech. Thank you.